you today? Good. Let me go ahead and shut that curtain for privacy. My name's Sabrina. I'll be your student nurse today. Could you state your name and date of birth for me? Okay, let me go ahead and verify that on your ID band. Everything checks out. So today I am going to be administering some of your medications. Before we begin, I am going to call the provider just to check and make sure everything is good. Before I do that, do you have any allergies I need to be aware of? No, okay, and are you in any pain at all? Okay, and can you state your pain on a scale of 1 to 10? 4? Okay, I'm going to go ahead and call that provider, and then I will go ahead and start to administer your medication. Ring, 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 ring.
Hello.
Hi, this is Sabrina Cigliano. I'm a nurse here over in the orthopedic unit. I have your patient, Edith Jacobson, in room 1555. She is a white female who was admitted last evening due to falling that caused her hip to be fractured. She also has a history of osteoporosis for 10 years, and she has a bunch of dizzy spells. Do you know which patient I'm talking about?
Yes, I believe I do, but continue.
Okay, so her vital signs are stable, and she is prescribed enoxaparin, morphine, and
Hydrochlorothiazide, right?
yes.
Okay, yes, I do know who you're talking about.
Okay, awesome. I have a few questions about her prescription that you provided. So first off, she was prescribed 30 milligrams of enoxaparin and every 12 hours until surgery. However, I was just wondering, since she is having a hip replacement and she is pre-op, if you wanted me to switch that to 40 milligrams every 12 hours.
Oh, yes, please. That sounds great.
Awesome. And then the second one is she has a morphine prescription as needed, and 5 milligrams, and it is in the IM. I was just curious if you wanted me to switch that to subcutaneous just to prevent hematoma.
Yes, great idea.
Okay, awesome. And then the last one is hydrochlorothiazide, but I am good on that one. We take it 12.5 milligrams orally right before a meal. So I think that is all. And let me go ahead and verify all of that again for you just one more time. So we're going to switch to from morphine sulfate from IM to subcutaneous. 5 milligrams is needed. Is that correct?
Yes.
And then we're changing enoxaparin from 30 milligrams to 40 milligrams now and every 12 hours before surgery. Is that correct?
It is. Thank you so much.
Awesome. Thank you. I'll call you if I have any more questions.
Okay, great.
Okay. So now that I've talked to your provider, we can go ahead and start on the medications. I'm going to begin with, I did my dosage calc, so I know exactly what to give you. I'm going to go ahead and put on some gloves. I would have come back in and identified the patient again and all of that, but in this case of the video, I'm already in here, so. So first things first is I would have checked 3 times for the medication, for all of the medication, so it would be as soon as you're taking it out, and then as soon as you're going to double check it with the bar and at the bedside, and right before you administer it to the patient. So first things first is we're going to start with the enoxaparin. I'm going to go ahead and just give you some details just about adverse reactions and patient teaching and things like that, just so you know a little bit about the medication before I start. I'm going to go ahead and get you all cleaned up and ready though, just so we can let the alcohol pad dry on your skin, just to clean everything up. So we're going to go ahead and do that in a circular motion. Okay. So before we administer the enoxaparin, we're going to want to assess for bleeding, and we're going to want to draw blood to establish baseline clotting factors and platelet levels, which should be around 150,000 to 400,000. And then we want to make sure that the patient is not allergic to pork or heparin, which in this case we asked for any allergies, and the patient stated that she did not have any allergies. And we also checked the MAR just to make sure, and she does not. We also want to administer with caution if they are on any anticoagulants, antiplatelets, SSRIs, or if they have increased risk for hemorrhage. And then once again, we want to assess for bleeding, and we want to assess their blood pressure just to make sure their blood pressure is not too high or anything like that. Okay, and then we want to teach the patient that to notify the healthcare provider if they're experiencing any bleeding, bruises, swelling, fever, nausea, or any other adverse reactions such as confusion, edema, hemorrhage, difficulty breathing, irritation, a rash, or fever. And so then we would also let the patient know that he or she wants to avoid over-the-counter aspirin unless it is ordered by the prescriber. And then we also want to have them watch for abnormal signs of bruising, numbness in the lower limbs, and muscle weakness. So now I'm going to go ahead and begin cleaning and getting ready for the medication administration. So once again, you would check, since I've already gotten it out from the MAR, you would check to make sure it is the right dosage and the right medication. Clean that. And then we are using a 27 gauge needle. So like I said previously, I did my dosage calc, and since it is 100 milligrams per milliliter, we are going to administer 0.4 milliliters. So you want to go ahead and take that cap off. And we're going to draw 0.4 milliliters. Show that it's 0.4 milliliters. Okay, so now we can give it to the patient. Since this is a sub-Q, we're doing it on the patient's abdomen. Since there is 2 sub-Qs, we're going to want to switch sides between the left and the right. So we will start on the patient's right side, and we're going to then the patient's abdomen and insert it at a 45-degree angle. And then we're going to inject. Medication. We're going to take it out the same way we put it in, and then put the safety cap on it. And then we are going to dispose of that in the sharps container immediately. And then I'm going to take my gloves off and get new gloves for the next injection. After I had administered the enoxaparin injection, I want to make sure to reassess the patient every 4 hours for bleeding, abnormal bruising, temperature. We want to monitor their platelet and their hemoglobin counts regularly, and we also want to measure their blood pressure. So next we are going to do a morphine injection. To begin, we want to assess the patient, assess their respirations. We want to make sure that they are not breathing below 12 breaths per minute, because if they are, we want to pause the prescription for morphine and notify the healthcare provider. And then we also want to monitor their heart rate and just to make sure they're not bradycardic or tachycardic. And then we also want to monitor their pain level again, ask them if they're in any pain, and have them rate their pain on a scale of 1 to 10. This patient is at a 4, so we are going to administer the pain medication. And then we're also going to ask for any history of sleep apnea or snoring or addiction or anything like that. So once that is done, we also want to just administer with caution because it can tell the patient it can decrease adrenal gland cortisol production. And like I said, we want to make sure that they are not sedated because it can increase risk for sedation and respiratory depression. And then we also want to tell the patient that this medication can cause lightheadedness, nausea, seizures, anxiety, constipation, and difficulty breathing. And if they are experiencing any adverse reactions like this, to notify the healthcare provider by hitting their call button. Especially this patient does not want to get out of bed because she is at a high fall risk, and now especially giving morphine, that makes it even worse. We also want to tell the patient to try to take deep breaths, cough, turn, and to use her incentive spirometer, and to use her call button once again if she wants to get out of bed. And also we would want to tell the patient that when she gets out of the hospital, if she's on morphine, she does not want to drink on this or drive a motor vehicle or anything like that, because it does cause sedation, or not sedation, but it does cause sleepiness and dizziness and things like that. Some more adverse reactions we want to tell the patient that are very important are bradycardia, cardiac arrest, shock, hypertension, palpitations in the chest, apnea, respiratory arrest, or respiratory depression. And so once the patient has been taught all of the different adverse reactions and things that could happen, we can go ahead and administer. So I would take an alcohol pad, and in this case we're out of alcohol pads, but I would act like I have one, and we would clean it around the site, and we would want to do this on the opposite side of the injection that we did last time. We want to do it in a circular motion from inner to outer. And then we would also take a new alcohol pad if we had it. We would check the medication dosage again, and I did my dosage calc, so it would be at 0.5 milliliters. So we would clean the outside of that with the alcohol pad as well, and then we would get the syringe ready. And once again, we're using a 27 gauge syringe, and you don't want to administer more than 1 milliliter in a subcutaneous injection. So I'm going to go ahead and, since this is clean, poke that down in there and withdraw 5 milliliters of morphine. Okay, so I'll show you that I have 5 milliliters of morphine. And so then I can go ahead and administer it to the patient. So I'm going to go ahead, like last time, squeeze or pinch the patient's skin and administer this at a 45-degree angle. I'm going to go ahead and insert that's good. Insert the medication, and then I'm going to want to take it out the same angle that I put it in. Then I want to put the safety cap on it, put it in the sharps container, and then now we only have your oral medication left, so your injections are done. So I'm going to go ahead and put on some hand hygiene. And before we begin, I also want to talk to the patient about patient teaching and adverse reactions and stuff as well. So this medication is hydrochlorothiazide. This is for edema. So we want to make sure to assess the patient's blood pressure before intake and output, and electrolytes such as creatine, bun, and uric acid, and glucose levels. We also want correct electrolyte imbalances before administration, and dehydration. We want to check and make sure that the patient is not dehydrated. For example, we want to check their turgor, make sure the capillary refill is less than 3 seconds, and we also want to check their weight. So before I begin, I would put on gloves again, and I I would assist the patient into a high Fowler's position to prevent aspiration. Since the patient is taking this orally, I would also ask to make sure the patient hasn't had any difficulty swallowing or anything. And then I would go on to teach the patient. I would tell the patient we would take it in the morning, an hour before a meal. In this case, that is the case. And we would also tell the patient that they do want to take this with a meal just because it can cause GI upset. And then it can also cause hypokalemia, so we want to check and monitor the patient's potassium levels. And then we also want the patient to report any signs and symptoms of muscle weakness and cramps, and if they have any signs of dizziness, headache, weakness, nausea, or respiratory distress, to hit their call button and let us know. And then we also are going to educate the patient on incorporating potassium-rich foods in her diet, such as bananas, just because, like we said, their potassium levels, this medication can cause hypokalemia. We want to tell the patient some more adverse reactions. If this was in a real-life scenario, we would be getting a new glove. But this can cause anemia, leukopenia, weakness, restlessness, headache, vertigo, dizziness, anything like that. So if the patient is ready to take the medication, we can go ahead and do that. So we want to verify again before administration the accurate dose. So in this case, the accurate dose is 12.5 milligrams orally. So I'd go ahead and check that this is 12.5 milligrams, and it is, and so I cannot give a oral medication to a mannequin, so I would administer this by putting it in a cup and water, and then make sure the patient takes it. So after that, I would, an hour later, I would reassess their intake and output, dehydration, check their blood pressure, their weight, their potassium levels, and any signs and symptoms of hypokalemia, such as muscle weakness or cramps, and monitor their BUN, creatine, uric acid, and glucose levels.